Hello, everyone, and welcome to Compassionate Chats. I'm Tanys Coughlan from My Place Home Care. I'm joined by my co-host, Heidi Gagne.
Hello.
Hello, and we have an awesome guest today, George Zahalan.
Hello.
And I just want to thank you for coming for this.
Thank you for having me. It's a pleasure, for sure.
It's great. And why don't you tell people a little bit about yourself?
Fantastic. Yes, absolutely. I don't like usually to talk about myself, but for you, I will.
Thank you.
So I am a pharmacist in Ontario, Canada. I have been licensed since 2013 in good standing with the college. I run, own, and operate a company of pharmacies called Valley Health Pharmacies, which is a community chain of pharmacies, but we also specialize in servicing group care homes, retirement homes, long-term care homes, complex care homes, et cetera, et cetera. And currently, we're the only independently owned and operated pharmacy chain in that space. So,
Okay.
Awesome. Big job.
yes.
And I do also want to point out, because George doesn't like to talk about himself, but he was one of the top 40 under 40 award recipients in 2025. So I think that's something that should be celebrated. I think that's amazing.
Absolutely.
Thank
and
you.
you should be proud of that fact.
Thank you so much. Thank you.
That's awesome.
So we kind of wanted to have a pharmacist on because I think it's October 18th is Pharmacy Technician Day. But I think there's a lot that has changed for pharmacists in the last little while in Ontario, whereas you are now allowed to kind of assess and prescribe more. And I'm assuming this is probably to help with overrun doctors' offices and hospitals, and also so the more minor things one could go to the pharmacist. So I think the first thing I would like to talk about is what can pharmacists do now that will help patients and people?
Absolutely, yeah. So it's a great question. Yes, we are able to prescribe. So as of January of last year, we are able to prescribe for a set of conditions called minor ailments. So these are basically health conditions that have very easy and simple to assess criteria and diagnostics for prescribing, whereas the chance that there is a misdiagnosis or incorrect therapy is extremely minimal. So even as pharmacists, we are, I think, the most well-versed for therapeutics and treatments. We do also get taught, especially in Canadian universities and American universities, they do actually go the extra step to teach their pharmacists how to assess, diagnose, etc. Diagnosing, though, is not one of our approved activities in the health charter in Canada. Okay. But it's like the term diagnosing, but we are allowed to assess. So minor ailments are conditions where an assessment is acceptable in order to enable a treatment. So those include things like cold sores, mainly for recurrent cold sores. So we cannot prescribe if it's your first time with one, but if you've had one and you know there's a pattern of actually experiencing them, we also can prescribe for things like eczema. We can initiate antibiotics for tick bites, because obviously that's important to prevent Lyme disease progression. Right. And there's a whole kind of a host of them. For us in our practice in Valley Health, the most popular one definitely is the urinary tract infections one.
Right.
This excludes male infections though, because of how our urinary tracts are, they're very long compared to females. So usually if you get a bug that can cause an infection in a male, it's usually a nasty bug because of how long that tract is. It would take something pretty aggressive to get up as high as that. Okay. So if it's a male, for example, we would immediately give a referral to a hospital or to the doctor. But it's usually for females. So definitely we do a lot of prescriptions for elderly females or females in care homes where there might be an issue with like cleanliness or activities that might lend itself to that.
Yeah, UTIs can be detrimental at times for people because it changes everything. Like for somebody with dementia, and to get a urinary tract infection, that can change their entire personality and their health. So it's really great that a pharmacist is able to, at least for females, at least be able to kind of be the first line of attack on that and be able to at least start it. So you were saying that these therapies, is it because if you miss the assessment, like how is it that you're allowed to do it? So if you look at a tick bite and you're like, okay, maybe we should do antibiotics. So I'm guessing if it's not a Lyme, what's the word? The tick didn't have Lyme, then it's not really going to hurt somebody have these. So is that kind of what those little ailments are, so that if you do prescribe an antibiotic, it's not really going to hurt the person if it's not fully Lyme disease, or it's not?
Exactly. So it's basically a condition where the downside or the danger or risk of treatment is very minimal. Okay. Right? Like for example, like there's no way to know which ticks carry Lyme disease, right?
Right.
In Canada. So we prescribe only if it meets the criteria. So every minor ailment has a specific flow chart or a criteria that we have to follow in order to get to the treatment phase, right? So for tick bites, obviously, if it's like a brown-headed tick, if there is a bullseye rash, these are the flags that tell us, yes, like we should give doxycycline or some other antibiotic as prevention or prophylaxis, we call it, to be fancy, for that. And then, other conditions like for example, cold sore, right?
Right.
If you've had a cold sore before, you generally know what it feels like. The person has had them probably before when they're feeling run down, tired, they're not sleeping well. They feel that like tingle on the lip. They get the cold sore, it lasts for 7 to 10 days. So for us to prescribe antivirals rather than have the patient book an appointment with the doctor, and maybe by the time they get in to see them, the cold sore is gone and it's already caused damage and scarring, right?
Right.
So, the antivirals we have for cold sores are pretty harmless if you're an overall, pretty healthy person outside of other kind of exceptions. So even if we're not sure, again, it's the overall risk is minimal that one, it would have been misassessed, and number two, the overall risk of those antivirals are pretty minimal in the grand scheme of things.
Okay. So now this is relatively new, allowing pharmacists. Was there retraining or more education required for pharmacists, or you already taught this?
So in terms of how to assess and treat, we already taught this in school, but when they kicked the program off in January of 2023, prior to that, there was a deadline that pharmacists interested in doing this had to do additional training. So we had to go through a course through the Ontario Pharmacists Association that basically helped as a refresher. Because for some people, it might have been 2 months from the time that they graduated, 2 years, 10 years, 20 years plus.
Right.
And these are things that, like, if it's not a large disease state like cardiac or cancer, we were taught them in school very briefly, right? Like the cold sores was maybe like a discussion in passing versus chemotherapy where we learned a fair amount, or cardiac diabetes where we learn more. So yes, and the overall idea is to try to unburden or deburden the Ontario healthcare system. But it's funny because a lot of the provinces of Canada, they've been doing this for years prior, but the Ontario Medical Association, OMA, was the only provincial body of doctors that was against the pharmacists getting that. So
really,
we had tried to kick this off in 2016, and they pushed back for 7 years until we finally did it. Yeah, even though these are patients, frankly, that they would never see because they just don't have time for it, nor do we have physician resources to take them.
Right.
So there was a little bit of like a possessiveness, I would say. So it's been hard. And Ontario is also behind for other things for us to do. Like other provinces allow pharmacists to order blood work, which for certain health conditions and drugs you're on, it's vital. Again, there's been a pushback from the OMA on that. I would say definitely the most progressive province has been Alberta, where with additional training, a pharmacist can prescribe pretty much like a family physician can for like all things.
Wow.
Yeah,
That's
absolutely.
great.
Yeah.
I wonder when we're going to get that.
It
I
would
mean,
take a
Big
lot of
zero. I don't think that will ever happen in Ontario. Big O for Ontario, I think, for that one.
Really?
I mean, it must take a lot of pressure off the system, though. When
Yeah, you would think.
out there,
It
I
does.
would think.
It
Yeah.
does. And it's cheaper for OHIP, I'll be frank, right? So
Yeah.
for like a minor ailments assessment, it takes us a lot of work and time, but we're getting like a pretty cheap assessment fee of like $18 to do the assessment, right?
Yeah.
Mhm.
And I mean, if you were to see a doctor, it would charge OHIP for about 2 or 3x that, right? It would be 2 or 3 times more expensive. So it's cheaper, it's faster, people get the care they need. Again, they have authorized it for a lot of health conditions with very small amount of kind of space to make a mistake.
Mhm.
So and I know that I touched on a couple of the states, but as of January 25, they actually added additional ones. So right now we're up to a total of about 19 minor ailments.
Oh, that's good.
So, can you tell people the difference between the assessment and a diagnosis? Just
Yes,
those terms.
absolutely. So basically, an assessment is made for, again, a condition that is not too complicated, and it can be pretty much completed, avoiding further testing.
Okay.
Diagnostics would actually require a person, let's say, to get like imaging done or further blood work to confirm this and that. So this is why diagnostics are outside of our scope, because in school, again, we only have 4 years after undergraduate. We like to get a professional pharmacy degree. It takes 4 years. So it seems like a lot of time, but it's not, to learn all the drugs and all the therapeutics and all of the side effects. So they just don't have time to squeeze in complex diagnostics there. But for assessments, and honestly, I would say as a pharmacist, depending on your practice, if it's more clinical, you're spending about half the time assessing during the day anyways, because you're getting patients coming in with, with other problems too, right? Like they'll say, I have pain in my hip. So then we have to assess, okay, what kind of pain is it? Is it hip fracture? Do you have osteoporosis undiagnosed? These are the thought processes that go into it.
Mm-hmm.
So it's almost like an early triage.
Yes, exactly.
Where you can, okay, we can rule out all this, but now I can't go further than this. So we've ruled out all the minor stuff. Now you need to go. And so instead of spending a day in the emergency room waiting, they've spent 20 minutes, and now they're like, okay, I can call my doctor and book an appointment.
Exactly.
That's
exactly.
really handy.
Yeah, exactly.
Okay, so I have a surprisingly enough, I was on Facebook Reels. Weird. The other day. And there's this woman that went on a rant, and I'm pretty sure it's in the US, but I would imagine dispensing medication is basically the same.
Okay.
But she was ranting about how she went into the pharmacy, and it looked like they weren't doing anything, which is always false. But they were standing around, and she had an issue with her prescription. And then the pharmacist was like, okay, well, that's going to be about 15 to 20 minutes. And then it ended up being 30 minutes. And she's like, they didn't do anything. They were just standing there. And granted, I've been in a rush before. I've also had those feelings of like, seriously, how hard is it to count pills and put them in a bottle?
Yeah.
We're all think it's super easy because we don't have to do it. So what is the step the pharmacist has to actually take to fill a prescription? So we can all be understanding of pharmacists.
I'm sure there's more to it than that.
No, for sure. And I would say I guess from the patient perspective, a lot of frustration comes because as pharmacists, I would say we are the worst advocacy body out there in terms of like healthcare people. Like there's no union of pharmacists. We have an OPA, but the OPA, while they're extremely valuable and great, they do, like, sometimes we as pharmacists feel there's a little bit of conflict of interest because you have like a Shoppers board member on the board of OPA. Well, I don't work for Shoppers, so are they actually representing my own thing? So I would say definitely there is an issue with us not kind of actually advocating for ourselves properly. And I guess the other reason for that frustration is because when they come to see the pharmacy or the pharmacist, it's the end of their process where they might have been waiting, God forbid, 6 to 8 hours in a hospital or longer, or 4 hours at a doctor's office. So we're pretty patient, and we're used to getting attacked from all angles. That's the joke in pharmacy. Yeah, like the patient will be mad at us, or the doctor will be mad, the family or POA will be mad at us, whatever. But we're used to that. So I would say in terms of the actual counting of the, so I would say like in terms of the actual counting of the pills, this is probably like 5% of the process.
Right.
95% of the workflow goes into, again, like assessing the therapy, confirming that it's safe to go with all of the medications there, trying to attain like an adequate history, like, are you taking anything over the counter? Do you consume, marijuana, THC, which can interfere with a lot of medications as well. Like, there's a whole gambit of stuff. So a big part of it is the assessment part, and then there's the preparation part of it itself, and then it takes longer if this prescription, if it has to be put in a blister pack or whatever it might be.
Right.
And then there comes the education part. Like, by law, we have to teach you about the medication, tell you what are the benefits, the risks, the pros, the cons, doing all that stuff. So we're doing all these things, which makes up about 90-95% of the workflow, and a lot of the time we're doing it in our heads, so you don't see what we're doing because you're not in our heads, right?
Right.
Yeah.
And then it could be that we're calling the doctor because there's a problem with the prescription. Again, just like we don't get a lot of diagnostic training, they don't get a lot of therapeutic training, honestly. If you speak to a lot of physicians, even ones that go to like the top tier schools here in Canada, America, etc., they might get like one small block a year of pharmacotherapy, or they might get one full semester of it, or whatever the format of the program or the curriculum is. So if a patient is like a diabetic and they're getting a blood pressure pill now, because now on top of diabetes they have high blood pressure, and they get a prescription for Ramipril, also known as Altace, it might be too high of a dose based on the fact that they're diabetic, maybe they have kidney problems. So we need to then fax the doctor or call them, or in some cases we can actually make a pharmacist adaptation to the RX, which is usually like a last ditch resort. So there's all these things that are going on. And also note that the pharmacy is also working on patients that you don't see, right? Exactly. So there like could have been that morning prior to that lady on TV was at her pharmacy, there was maybe 50 people before her that said, we'll come back later. So those people don't just get bumped down the queue because some person chose to wait there, right? Now, I do understand, again, like I said earlier, there is a frustration because they don't see it and they've been waiting a long time. Also, with a lot of big corporate pharmacies, Walmart, Shoppers, they are mandated to make you wait a minimum of 15 to 30 minutes because yes, and I know because I went through the associate owner course at these various companies. So they would teach us to tell the patient to wait because they're 34% more likely to buy something over the counter if they're waiting because they're roaming the aisles, right?
Wow.
Yeah, and those little pin pads that they give you that buzz, they only buzz if you're in the store. So if you go wait in the car, it doesn't work. So they want you to it's almost like a tractor beam from Star Wars. They try to keep you in the store so you
I love that you said Star Wars.
Yeah, so you will come in. Yes. No, it's good. I was actually having my first conversation the other day with my oldest son about it because he was actually asking me about it, and I said, now, son, you're in my wheelhouse now. So yeah, for sure. I'm excited for him to get into Star Wars. So so they try their best to keep you in, and I'll be honest, a lot of the margins for profit on prescriptions is very low. People think that because you own a pharmacy, it's a cash cow. It's not. And a lot of the front store items, they don't have caps as to how much profit that a pharmacy can make, right? Some products might be marked up 30, 40, 50, 60% versus a prescription where we're only allowed 5% or 8% markup. So it's very, very thin. Right?
That makes sense. I mean, I live in a small town, well, a little village, I should say, along the 401, and we do have a pharmacy in town, which is amazing. But it is scary looking at the actual over-the-counter shelves and the pricing, because it is easily $10 to $15 more for certain things than you would find at Walmart or Shoppers. But Shoppers is also expensive too.
Yeah, exactly.
But yeah, so that kind of makes sense. That's sneaky. I just sit there and talk to the pharmacist technicians because or the staff, because I know them all. Because I live in a small town. So we just chat about buying things.
We get that at the shoppers and whatnot, right? It's always different.
Sure,
but I think there'd probably be a bonus for always going to the same pharmacist and having a regular pharmacist, for the reason of things like, you're diabetic and suddenly you've been put on blood pressure medication. And if you just
polypharmacy is a serious problem. Oh, yeah.
Yeah.
Polypharmacy is a serious problem, especially in Ontario, because we don't have a system to track where you've filled something unless it is a narcotic. Then it goes through a Health Canada, a federal program. It's called NMS, Narcotic Monitoring System. The only way for us to know if you filled anything elsewhere is if we log into a portal that is run by OHIP. But in order for us to see that, the prescription has to be ran through OHIP. So if you're not like a 65-year-old and over, or you're not on ODSP or OW and you have private plan or you pay out of pocket, I won't have any way of knowing that you filled that prescription elsewhere. So polypharmacy is definitely a problem. And the process of transferring pharmacies is also a serious problem. There are a lot of pharmacies, unfortunately, that have gained the system, and they pay patients off to transfer, or they'll offer them like illegal perks or a front store discount. So you're not allowed to do any of this stuff to gain business.
Right.
And it's sad too, because as like an independent business owner, we work tirelessly to make the patients happy. But it's almost like if they're unhappy with one thing that happens, they can walk into any pharmacy and just give verbal consent. They don't have to sign anything. They don't have to pay a transfer fee. They don't have to do anything. They just go into the next pharmacy and say, hey, I had a little argument with John over there at like John's pharmacy. I want to transfer. And then all of that hard work and all that goodwill that you thought you had is gone out the window. So it's definitely like a loyalty issue, but it's a product of the system. I think it's too easy to transfer pharmacies in Ontario. And if you look at it, if you're trying to transfer like dentist or doctor offices, that is hard. They're allowed to charge like transfer fees for transferring the files over. But in pharmacy, we're not allowed to do any of that stuff. And oddly enough, like even if you've had patients for years and years and years, and if you didn't do anything wrong, or they got a delivery a couple of minutes later than they're used to, you'll see there's extremely little kind of room there for errors. Yeah,
that's crazy. I mean, because I live in a small town, I've been here 17 years, almost 17 years.
Yeah.
And we've gone through like 4 pharmacists. And I remember the day the pharmacist was retiring and moving out east. And like, I was like, okay, what am I going to do? What am I going to do without Nancy?
Yeah.
She knew everything. She knew everything. And then, and now we do have a new one that's staying, which is, she's lovely. So I'm really excited about that.
That's
because
nice.
I think it's really important to create that relationship with your pharmacist, especially if some of your prescriptions are time sensitive. Like you need to take them every single day. And there's been some times where the doctor office delayed in sending the prescription back, the approval. And so then I'd have to go and say, like, my husband needs to take this. And so they would be like, okay, well, we know your history. We know everything. I'll give you 2 days worth to get you through the weekend. And that kind of helps because it's some things you can't suddenly stop taking, even for 2 days. So it's kind of, I think developing that relationship with your pharmacist is super important for situations like that. And then it gives you that opening of that understanding and being able to ask them these questions, because some people are afraid. Like, I've told my doctor, everything, and I don't want all these people to know. But pharmacists have the same confidentiality requirements. Most of them have little rooms with the door that you can close and go talk privately and everything like that. So I think people should really start relying more on their pharmacists and take advantage of what they have.
And it's about building that trust with them, right? I know I had the same pharmacist for like 35 years. And she just retired.
It's hard.
Yeah.
When they leave.
It is. I miss her.
Because you don't have to ask the questions. You don't have to. They just know. They know these things about you. So, and I think the benefits of having the same pharmacist as well is so many healthcare professionals, doctors are now like oh my gosh, like I go to Home Street practice in Brockville, and there's 4 or 5 doctors. I have my main doctor, but if it's an emergency, I might see somebody else who might not know everything about me. Healthcare team, sorry. So but if you have your pharmacist who sees every prescription and everything and has the knowledge about you, that if you were to suddenly see an off doctor due to timing or whatever, they could go, oh, wait a minute, is this new? Like, wait, who prescribed this? And it's just one more thing that protects you. So develop that relationship with your pharmacist.
For sure. And no, honestly, I can say, like, we have patients at all my pharmacies. Like, in general, any of the pharmacies I own tend to be in smaller towns because of that reason. But definitely when you go more into the urban areas, it is very tough for sure. Like the only store that I have in like urban Ottawa is downtown, and there's a new pharmacy opening up every 4 to 6 months, and there will be an efflux of patients, and they'll come back and come to find out that they ended up transferring out for some perk or something like that they got, or some payoff again, which is not legal. Like, it gets extremely grimy, and I think it's out of hand. Like, I think the Ontario College, they have to come down a lot harder on that, because it's part of a larger issue. And I think there should be rules for geographically opening up a pharmacy. Like, if there's already X amount in a certain geography, they should not be just kind of allowing them to open up more and more and more. There has to be, because if it continues, it's just going to be overrun with a lot of pharmacies, and it's just going to be a race to the bottom, honestly. Like, trying to, oh, well, I got a discount of X dollars here, and then they go shop that deal around and get more. Again, it's more common like this in like urban areas, but it is definitely a part of a larger issue for sure in pharmacy.
The underbelly of pharmacy.
Yeah.
Who knew there was an underbelly of pharmacy?
Oh yeah.
Oh yeah.
It gets rough out there for sure.
Yeah,
it gets
definitely.
rough. Absolutely.
So doing things like this helps to raise awareness, at least, right?
It does.
For people.
Absolutely, for sure. And it does, I guess, allow people to hear from a pharmacist perspective. Like, if you're upset at your pharmacy because they did like one thing wrong, or they didn't have your full amount of medication ready, or minor things, don't just think, you know what, I'm going to get back at them, like I'm going to transfer out. Just know that, at least me as an independent owner, I don't belong to a Shoppers, Walmart, or these groups. I own my own pharmacy. So we value you as a client. If you have an issue, come and talk to us, ask for the owner, ask for any of the managers at my stores that manage for me. Talk to staff there that you know very well, even if they're not like a manager, or if they don't have a higher up job, if they're a pharmacy technician, right? Because now we're talking about Pharmacy Tech Day, right? So, and like a lot of them have more patient interaction sometimes than us. talk to them, disclose what happened, don't just give them silent treatment, walk out the door, and then 5 minutes later, we'll get a call for transfer. Because as an independent owner, every file, every person is important. Even if you fill one prescription, that helps me to feed the families of my employees. It helps to feed also my family. It helps, it goes everywhere, right? And like to just do that, again, I know that it's a product of the environment. It's too easy to transfer, frankly, but also know that like the goodwill should extend both ways. Our job is to establish goodwill for you and with you, and what I think is like that should be reciprocated. And again, I have a good like all my stores are good. We have great practice. We've had patients we've had for years and years and years. But every store, every pharmacy owner or manager can tell you about one little issue, and then it affects everything, right? Like if I wanted to give Christmas bonus for people, and then a family ends up transferring out, or a person is unhappy and they tell their uncle, and now their uncle transfers out, and then the aunt transfers out, and they tell all of the neighbors, and then they'll leave and come back. Like there is a whole thing that goes behind it. We're not just business people, we're also humans as well, and we're pharmacists. We came into this space because we want to take care of you. So let us try to take care of you and take the best care of you.
I think that's a really important thing for in general though too, is you don't just walk away really quickly. Like there has to be something really bad to make me walk away from somebody that I've been going to for a long, long time.
Yeah.
And we
how it should be.
Yeah. And I think we need to embrace that more. And that loyalty is important, especially for a small business or a local business who has been working super hard to get to that point. But not everyone sees that. Everyone thinks a pharmacy is like a cash cow. I mean, I've heard it from people about home care companies, it's just easy money. It is not easy money because we're dealing with people's lives and not just our clients or patients. We're also dealing with our lives and our caregivers and your employees. And so these things have this horrible domino effect. And I don't think people always see that.
No,
well, and I think in general, right now it's difficult for people to talk to each other. Communication is something that it's declined a bit, and probably COVID had something to do with that, right?
They'd rather write a bad Google review than to actually go in and say, hey, listen, this really pissed me off. How can we fix this?
Or even asking them to post a good one, right? We've had, like I have patients every week coming in saying, oh, I just want to let you guys know that you're great. You're the best pharmacy that we ever had. Thank you for your services. You ask them to post a review and it doesn't happen, but you upset one person because the prescription was ready at 1 o'clock instead of at 12 o'clock, and then you get a 1 star, and you're like, it's, and I think it's a sign of a greater societal issue where people emphasize the bad more than appreciating the good, for sure.
Side note, I was at Walmart one time a few years ago, and I went through the cash, and he was a young guy, teenager, and he was so sweet, so kind, just a great conversationalist for like the 5 minutes that we spoke. And I'm like, you know what? I just need to go tell somebody how awesome he was. Amazing. And I went to the customer service desk. I'm like, do you have like customer comment cards? And they're like, oh, what happened? And I said, oh, no, I just want to make a positive comment. Yeah. They were like, oh, here, let me get you some paper.
It was probably like a lottery for them because that never happened. Yeah, they
were totally ready to just listen to me berate them for some stupid thing, but no, he was just really wonderful, and I just wanted to tell them and let them know that they have a good person working for them. And I think we need to do that so much more.
Absolutely.
And pharmacists definitely need to be included too.
Honestly, it all comes down to grace. Grace is a word. A lot of people don't even know what it means. They don't even know how to define it. But again, it's an important term. Just trying to give grace to others and expecting or hoping that they would give you that same grace is super important. Like for me, my faith as a Christian is like my number one thing above all else. And we're taught all the time, show people like as much grace as you can. But I think as a society, a lot of people have lost that idea, or just offering the same grace. Like we had a patient, it just happened yesterday, actually, honestly. We had a patient transfer back. I didn't even know she transferred out because we didn't get a transfer request. She just got a new set of prescriptions and she went to the shoppers in town and she was with them for 2 or 3 months. And I was wondering, I'm like, I haven't seen Pamela in a while. Where is she? And anyway, so she comes popping in and I'm like, hey, like, how are you, stranger? She goes, hey, I'm good. I'm just here to transfer back. I said, oh, I didn't even know you transferred out because we still had some like valid prescriptions for you. Again, because we don't have a system, I don't know if you filled somewhere else, unfortunately. And then I said, why, what happened? And then she's like, yeah, it was a big mistake. I went to Shoppers and it was like a horrible experience. But I said, well, what happened that caused you to do that? She goes, well, as you know, I was sick and for a period of time, I was undergoing operations and I was asking you guys to do, like a delivery. And I told you guys to come at 8, but the last time that I had a delivery, it came at 8:30. And I was like I understand it can be frustrating. I have empathy, but Pamela, why didn't you just pick up the phone and call me and say, hey, George, the guy came at 8:30 when he knows, because I was not feeling well after heart surgery. I fall asleep earlier. Like I would have, done anything different. Again, it just takes that. And this is a patient that had been with me for years and I didn't even know. I mean, thankfully, everything ends up fixing itself in the end if you're a good person ultimately. So we got her back, but I didn't even know she left. Again, there was no grace being showed, unfortunately. So
that's hard.
Yeah, for
grace
sure.
is, and we need to show it to ourselves too, right?
Absolutely.
Absolutely, everybody is, like I always say this, we're perfectly imperfect.
Yeah,
we're exactly how we're meant to be, but
for
we're
sure.
perfectly imperfect. Nobody is perfect. So
all of us are a broken piece of glass, a part of like a bigger frame.
Beautiful mosaic.
Sure.
That's right.
Yeah, absolutely.
Well, and I'm sure pharmacists also, you're usually at the end of the line, like you had mentioned earlier, of a very frustrating process for many people. And all they want to do is get their medication, their prescription, go home and take it and like fall asleep because maybe they've been up for 4 days.
I just want to get my prescription. Absolutely.
Yes. And it's very difficult to get your own mental state out of that, to go, I need to be understanding because these people are just doing their job.
Yeah.
Absolutely.
We're all just working together, right? To make the world go around.
We just have to remember that somebody else is also having a bad day.
Yeah. Always. Yeah, absolutely. Again,
it
always comes back to grace.
It does. It really does. It's true.
It's true. Sure.
And we saw it a lot in COVID when people would get upset. I was at the grocery store and I watched somebody throw a package of meat at one of the cashiers. I was like, why would you do that? Well, I don't want to wait in line.
Yeah.
Well, why are you throwing it at her?
I know.
And I went and got blood work done shortly after everything reopened for COVID, and it said on the little wall beside me with the blood technician, whatever they're called, and it said, basically, please be kind. We don't deserve you yelling at us. I'm like, who gets yelled at for blood work?
Just the fact that a business actually has to put that,
it's disgusting.
It's pretty outrageous.
Something.
Yeah, for sure.
Yeah,
like the first time we've ever had to put that disclaimer was at one of my pharmacies that I own in a small town, which generally people were always good to us, but during the pandemic, as you said, people were at a heightened kind of irritability and they lost all grace. Like the person who manages the store for me, Julie's like, George, I have to put a disclaimer on the voicemail. FYI. I'm like, why? Like saying what? Our hours or something? She goes, no, I have to ask people just to be patient because it wasn't only that we were busy during COVID because there was a lot of sick people that we're treating. We were understaffed because our staff got sick. So the workload doubled.
Yeah.
And then there was further restrictions. Again, people were not allowed to actually come to work if they didn't have a vaccine or they didn't have PCR test done, or if they had a sick child, then instead of taking them to daycare as normal cold flu season, they would have to keep them home and stuff. So like people were getting irritated. I get it, but we had to put a disclaimer. And it was unreal because it is a small town pharmacy and we never had, like, it's usually jolly and we're, it's just it was, I think, part of a larger thing. Again, it just like it comes down to grace. We lost it. And it's funny that we're here talking about Pharmacy Technician Day, because the technicians get it a lot more than we do, because they're usually at the front of the front line, right? They're doing like a lot of the intake. There are technicians that work in the back with like the preparation of stuff, but there's a lot that work on the front line as well. That's why job turnover is so high. And I think a mark of a successful pharmacy, frankly, is how long and how loyal your employees are and have been with you. So, it's always a thing that I'm extremely proud of with my locations. But yeah, it is, it's tough because, again, they usually get the brunt hit of stuff first, for sure, including phone calls and stuff. Yeah, absolutely.
Yeah.
Well, people in COVID, they were, in fight or flight a lot, because nobody knew what was happening, right? So nobody knew what was happening. Fight or flight, and when we're in
wrong information flying everywhere, and it was just to try to scare people, honestly. And everyone was scared. Everyone thought that first couple of months that we were working, people thought it was like a green cloud floating around, like in Ghostbusters, right? Like they thought it was a green cloud just coming to attack you.
That's hilarious.
And that was tough. So as a business owner, you have to be a lot more patient, a lot more like empathetic,
and you're scared.
Well, you guys are still in it too. Yeah, exactly.
Absolutely.
You're still activated too.
Yeah, and it's funny because I think a lot of people think that doctors and nurses are infallible, and same with pharmacists, but they're not. You guys are human. You have the same, like you have more education, on certain things, but you're still human. You're still going to make an error. And
you're still going to have emotion.
You're still going to have emotion. You still need to treat people kindly. Like I do feel bad sometimes where if I call in my pharmacy and I'll be like, is my prescription ready? They're like, no, we're all out. Or I can only give you 1 month instead of the 3 months because the delivery's coming in. And I'm like, oh, okay, thank you. Like, it's because you're like, oh, now I have to do this again. Yes, it's just down the street. But still, so it's frustrating, and I do feel bad when I do react like that. When it's like my initial thing of like, oh, okay, and I apologize. I mean, but these are people that at the Legion during a fundraiser I go hang out with. So like it's that's what's nice about small town pharmacies and everything. But we do have to remember that, and pharmacists now are able to, for the last year and a bit, are able to do so much more, and we need to realize that.
Absolutely, for sure. And honestly, I do want to give extra positive commentary. Excuse me. Like I for sure want to give extra positive commentary to all of the pharmacy technicians out there, because I always say the success of a pharmacy runs, or the pharmacy is only as good as the quality of your pharmacy technicians. And unfortunately, there are a lot of corporations and owners that don't value them or treat them well. But I think for me, I'm proud of the fact that I think in comparison I do, because I was I did that role. Like I started working in pharmacy when I was 13 years old as a cashier, and then I went up to being able to count the pills, and then I was working doing some stuff as an undergraduate, and then a pharmacy student, a pharmacist. So like I've gotten dumped on totally, so I know how that feels. Especially
you're a lifer, George.
Yeah, for sure. Especially as a 13 or 14-year-old, the pharmacy owners are ruthless. They will make you do all the tasks nobody else wants to do, pick up all the garbage people don't want to pick up. So it helps give you added emotional intelligence to know how to treat someone, and that's why honestly, like I feel for it. And it's funny, with my first pharmacy that I bought independently, I was getting contacted by a bunch of pharmacy techs at previous workplaces saying, hey, if you're ever hiring, let me know, because they knew how I was as a pharmacist, and they knew that I was very much appreciative of their effort. And I think at the end of the day, that's what it is. And it's not just money appreciation, which is important, but it's also just telling them like, hey, great work. thank you and like not dumping on them every opportunity you get. Again, it comes down to grace. If you show people grace,
It really does.
It will get internalized for sure.
Well, it's good HR practice, right?
Yes, for sure.
Says the HR lady.
Says the HR lady.
It's hard. HR is hard. Like as an owner, like I try to do it myself along with my managers, but it's hard. HR takes a good 40-50% of my spiritual energy. Yeah. Honestly, it sucks a lot out of you. So it's a very hard thing you got. Absolutely.
Well, and I've been in the home care business for 30 years now because I started in the field as well. So I know what it's like to be the home support worker and the, PSW turned into that.
The whole gambit. Yeah.
Yeah. So sure. I hear you on that, George.
Yeah, absolutely.
I worked in restaurants for years and I've gotten dumped on for things that I can't control. So.
Oh yeah.
Yeah.
I paid for my education, essentially my own, because my parents were not well off whatsoever. I paid for it with being like a busboy. So like a lot of that was actually
such a thankless job.
Yeah, absolutely. Especially for the busboys. Oh yeah. But for some reason, the dishwashers, they are treated exponentially better than the busboys are the lowest rung of the rung. Oh yeah, I got stories for days. Absolutely, absolutely, yeah.
And a thick skin, apparently.
Yes. Well, it really does. It does create a different work ethic.
Yeah,
I think when you've been through these kinds of experiences.
Yeah.
So it's
no, absolutely.
It's
absolutely. Like I told my wife, I said one of the first jobs, because we have 3 sons, that I want them to do, because a lot of men nowadays, they need to learn how to have a better work ethic, especially like the younger men. Honestly, I told them that I'm gonna get them a job as a busboy in the same exact restaurants that I did, because I still know the owners. I still go there. One of them, who was great, I got to give a special props and a shout out to the owner of the Giovanni's restaurant on Preston. His name is Nino. He was the best. He actually introduced me to a lot of big head honchos at Jean Coutu and shoppers who were eating there. And he said, if you ever need a job, George, I'm going to make them give you a job. I'm like, okay, that's great. And him and his family, they still own it. And they help you build that thick skin. And I always joke when we go there as a family, like I tell them, that I'm going to send my boys there to work when they're of age. So it does help a lot to build a good work ethic, for sure.
Yeah, for sure.
It does.
Yeah.
Well, I can't believe it, guys, but it's like way
over our time.
It flew by. So
absolutely.
Thank you so much, George. Do you have?
It's my pleasure.
If there was one piece of advice for everybody, what would it be?
Treat others as you want to be treated. And just know that everything is going to work out for your best interests. Those are 2 definite things from the book of Jeremiah that I've tended to actually live by in my life. And again, if you're Christian or not, it doesn't matter. We all can learn grace. We all should treat others how we want to be treated. And that's ultimately how we get the crazy world back into some form of order and positivity, and just everyone to like actually uplift each other. That's very important. So that's what I would do as a take home, for sure.
Beautiful.
Thank you. And pharmacists are working even if they're standing there.
We are. We're not just counting or punching numbers on a calculator. For sure. Again, grace. Everything that you talk about what's wrong, okay, or anger, where it comes from, it always comes down to grace. So show people grace. Be happy. Beautiful. Be calm. Appreciate their battles, and they'll appreciate yours. And
stay loyal to your pharmacist.
Yes,
stay loyal to your pharmacist.
Work it out. That's a good one too.
Work it out.
Exactly. Again, grace. Grace. It always comes down to that one word.
Yeah,
it's a big word, I tell you.
It is.
Absolutely. Absolutely. Thank you so much, Heidi and Tanys. It's been a pleasure. Thank you so much for having me, and I appreciate you asking all of your questions. It's been great. And if you need another voice on here for other topics, let me know.
Oh, we will.
I'm sure we'll be having you back, George. So
Thank you so much.
Thank you so much for your time.
Take care. Yes, and thank you to all of the technicians. I'll make sure to send this to them so that they know. Absolutely. Take care, everyone.
Cookies.
Yes. Take care of yourself,
everyone.
Ciao.
Back next time.
Bye-bye. Blessings.
Bye-bye.
Bye.